It's very special to be here at the bank on World AIDS Day. The bank was ahead of many in recognizing the urgency of the fight against AIDS. Its International Development Association was amongst the earliest supporters of treatment and prevention in sub-Saharan Africa. And today the bank is building on its HIV/AIDS work with an effort to strengthen health systems more broadly. The United States counts the bank, along with many others from the Global Fund to countless NGOs and businesses, as key partners in our health and development agenda. We look forward to working with you to build on the important progress we're celebrating today and to bring the same commitment and cooperation to an array of other challenges that lie ahead. We are well aware that none of us can go it alone in this continuing fight. Today is an important opportunity to reflect on our common commitment and shared progress, but also to recommit ourselves to the fight. Over the years, I've witnessed the damage brought by AIDS both here in the United States and around the world. It is not only a moral issue, though it is certainly that. It is an issue that gets to the very security and stability of the world that we share. During the 1990s, in a review of national security risks, I recall being alarmed to learn that the government of South Africa had to hire 2 people to fill every open position in its military because so many soldiers were dying from HIV/AIDS, particularly among the officer corps. But I've also seen over and over again our potential to make strides against this epidemic. In Tanzania earlier this year, I saw PEPFAR-supported hospitals serving thousands of AIDS patients who 5 years ago would have had no access to care. And they were also working to improve community health more broadly. Likewise, in Ethiopia, I met HIV-positive mothers whose infants had been born healthy because of antiretroviral treatments. A few years ago, those children would have had little or no chance of survival. So it's really worth pausing to note how far we've come as an international community. When I served at the White House as budget director in the 1990s, the political system and the public was not yet sensitive enough to the human costs, the moral burden, or the security and economic implications of AIDS. At the time, even our modest proposals to increase funding by hundreds of millions of dollars for international treatment and prevention faced almost insurmountable obstacles. Conventional wisdom at the time held that prevention and treatment services provided to the United States were not viable in parts of the world most effective. It's truly inspiring less than a decade later to come back into government and see how much has changed in the United States and internationally. Today, a bipartisan consensus drives continuing support for the fight against HIV/AIDS, and a new consensus is emerging for a broader effort to use the progress we've made and the platforms we've built to promote more broadly a sustainable approach to healthcare. Our excellent Ambassador Eric Goosby, the Obama administration's Global AIDS Coordinator, will be speaking to you shortly as part of a panel discussion. And later he's going to launch our new 5-year strategy for HIV/AIDS, making clear our commitment to extending and expanding the remarkable record of what has become the largest commitment in history by any nation to combat a single disease. And Secretary Clinton announced yesterday that we will host the 2012 International AIDS Conference here in Washington, a move made possible by President Obama's action to lift the long-standing travel ban on persons living with HIV. Before talking about how PEPFAR is a cornerstone of our new health and development initiatives, I'd like to highlight some of what's already been accomplished. When President Bush and a bipartisan coalition in Congress launched PEPFAR in 2003, antiretroviral drugs were virtually unavailable to people in the developing world, and prevention was almost non-existent. The United States spent more than $18 billion on global AIDS during the first 5 years of PEPFAR. In 2009 alone, we spent nearly $6.5 billion on bilateral HIV/AIDS and on the Global Fund to fight AIDS, tuberculosis, and malaria. These investments have had a marked impact. I'm pleased to announce that over the past year alone, PEPFAR directly supported life-saving antiretroviral treatment for more than 2.4 million men, women, and children, and essential care to nearly 11 million people. In the past year, PEPFAR has supported counseling and testing for nearly 29 million people. And through efforts to prevent mother-to-child transmission, PEPFAR prevented transmission for nearly 100,000 babies born to HIV-positive mothers in the last year.